age all have fibroids. Most of these needed, with or without symptoms, needed surgery before. And I'm happy that we have brought a technology with Philip partnership, which will make a significant difference in the lives of these women. Without surgery, without knife, without anesthesia, and it's a daycare procedure. They walk in and walk out and have this. Yes, what we have done in this partnership is, we already have Philips MRIs to start with. So in those MRIs, they have brought in this additional equipment, which costs, I think, around 5.5 crores. Each of these HIFU equipment, they placed it inside that same room. So it's a twin purpose room. With the MRI, which we are using it for diagnostic purposes, now with this HIFU will give us this opportunity to bring this treatment for a large number of women. Our costs, as I said, I'm not putting the cost together because we are not using this room and MRI only for this purpose.
So you were also talking about extending the facility to other hospitals.
Stabilize.
What is the share of private labels in that, sir?
Son?
Private labels in that?
It is still not very much. It's still less than 10%. Gradually, because what we would want is what is accepted both by the doctor as well as the patient. So gradually, I think, given the acceptance, they will, that percentage will grow.
And in your annual report, you said you are going to open up reach hospitals in Type 2 and 3 cities. What is the plan? I think
this is the promise that I've given myself. This is the need for our people. Why should people travel all the way to Hyderabad or Chennai or Delhi or Mumbai? Why not take these facilities to them? This is the broad principle of Apollo Reach Hospitals. When the Prime Minister of India, Dr. Manmohan Singh, inaugurated this concept in Chennai, we already have 6 hospitals on the Reach model. We have other 6, 7 are on construction, and another 10 probably is on the final stages of project completion. So we hope that we will be able to build a large segment of Reach Hospital, which will give only tertiary care and then move on to quaternary care and supplement the other number of private hospitals that are there, which are doing the primary and secondary care. We will not delve into what they are doing. We will be a supportive mechanism for 100, 200 of these primary, secondary care facilities.
And you are also planning to set up one 300-bedded hospital in Chittagong and another hospital in Sylhet. What are the plans for
I think our people went and examined the Chittagong site. They wanted a few more alterations in that site. So that's happening. Even in Northeast, just now as I speak today, the team is in Northeast to see whether we can locate a good, in a hospital, it's not only the space that we need. We need accessibility for people. What am I doing in these Reach hospitals? I'm 2-3 kilometers away from the bus stand or the railway station, so that our shuttles, this is where I think simultaneously we're trying to augment our training programs.
How many new beds will be added in this fiscal year? Either your own or...
As I said, our promise was that we will add the 2,400 beds, out of which we have already opened 1,200 beds. So
in this fiscal?
This fiscal, I think only another 400 to be left. We have more than exceeded our target in this fiscal.
So you have 8,000 beds as of now?
9,000, close to 9,000.
Close to 9,000.
Yeah,
what would the
50
figure
short
by
of
the end
9,000.
What would the figure by the end of this fiscal?
We'll only cross another 300 beds at the end of it, because there's only one project which will take off, apart from the expansions in the existing ones. But what is needed is the ones which are under construction, the 6, 7 hospitals, which will all be finished, because what we took was 10, 11, 12. That 2 years was that budget of 2,400 beds at 1,500 crores investment. We are well on target. We'll probably do ahead. As I said, there is a need, and I can probably build more hospitals, but what is needed is to simultaneously build this, the entire gamut of health system, which is the manager and the doctor and the nurse and the technologist. So we're, as I said, doubling our efforts in the training programs.
Has slowdown impacted inflow of patients from abroad?
I don't think so, because as I said, we expect that both inpatient and outpatient will last year saw about 60,000 they are expecting that this year will be probably over 75,000 patients. A third of them inpatient and 2/3 of them as outpatients. I don't think it slowed down, and as a matter of fact, I think if you, rephrase your question, this global meltdown is going to augment Indian healthcare services and move towards my dream of making India as the global healthcare destination.
Is it happening, sir, now?
No question it will happen, because we are the only people who have the resources. The resources, what I mean is not the money. What the human resources. Only India has. 10 years from now, this is not my word. The previous World Bank chairman typically said that. Mr. Wolfenson said, Dr. Reddy, my generation will get away, but the next generation has to depend on India. Because you have the people, you have the younger generation, you have people who are easily adaptable to skills. The best doctors, best nurses, best administrators, scientists, whatever it is, are Indians. We have that skill, but we had that inhibition before. If that is off, there is no stopping us.
And last question from my side, sir, which is unrelated to hospitals. There's a lot of talk about your political entry. Will it be happening through Rajya Sabha or anywhere? And now, given the latest developments, we sense something.
Thank you very much. I always wish that we could participate in country's growth, and it is not that you should participate in country's growth by being a politician. I have always kept away from being a politician. I have never seriously been tempted, and I will never be tempted. I think there is so much to do in my domain. If I do this, I am very happy, thanks to God.
So was there any offer from any
they always ask, but I have never accepted, and I have no intention to move away because there is so much unfinished work in healthcare. MRI tho, no operation ledu, no surgery, no anesthesia, and daycare procedure. ఎవరికైనా ఈ ఫైబ్రాయిడ్ ప్రాబ్లం ఉండే వాళ్ళకు వచ్చి ఒక ఎంఆర్ఐ ట్రీట్మెంట్ ఒక 3 అవర్స్లో ఈ ప్రాబ్లం కంప్లీట్గా క్యూర్ అయ్యేట్లు ఈ కొత్త టెక్నాలజీ ఇచ్చేదానికి నాకు చాలా సంతోషం. ప్రతి సంవత్సరం ప్రతిరోజు మా ఆశయం ఏంటి, మన ప్రజలకు ప్రపంచంలో ఎలాంటి వసతులు ఆరోగ్య వసతులు ఉన్నాయో అవి మనకు తీసుకురావాలి. ఈ ఫిలిప్స్ నాకేమంటే సంతోషం అంటే మొట్టమొదటి ఎంఆర్ఐ ఇండియాలో హోల్ బాడీ ఎంఆర్ఐ ఫిలిప్స్ ఎంఆర్ఐ తీసుకొచ్చినాం. ఈరోజు అదే ఎంఆర్ఐతో కూడా ఇలాంటి అడిషనల్ ఫెసిలిటీ అల్ట్రాసౌండ్ దీనివల్ల ఆపరేషన్ లేకుండా, ఎందుకంటే ఈ ఫైబ్రాయిడ్స్ అనేది చాలా కామన్ ఫీమేల్స్లో. యంగ్ ఏజ్లో పెళ్లి కాకముందర, పెళ్ళి అయిన తర్వాత మెనోపాస్ టైంలో 3 రకాలు చాలా కామన్ కండిషన్. దీంట్లో సిమ్టమ్ ఉండేవాళ్ళకి కొందరికి ఉంటుంది, సిమ్టమ్ లేని వాళ్ళకి ఉంటుంది. అందరికీ ఇది చాలా అనుపాయం, ఎందుకంటే ఆపరేషన్ అంటే ఆపరేషనే. అనస్థీసియా లేకుండా ఏమైనా చేయగలిగితే అది చేయాలి. లేడీస్కి స్కార్ లేకుండా వాళ్ళంటే ఇది మంచి గ్రేట్ బ్రేక్ త్రూ. అలాంటిది ఫిలిప్స్తో కూడా ఈరోజు హైదరాబాద్కు మొట్టమొదలుగా మిగతా అన్ని అపోలో హాస్పిటల్ తీసుకొస్తున్నామని మాకు చాలా సంతోషం.